Well, good afternoon, everyone. Thank you so much for joining us today. My name is Cliff Cullen. I'm the Minister of Education for the province of Manitoba. Today, we're here to talk about our government's Safe Schools Reopening Plan. This is following the recent announcement of new public health orders. We do want to ensure that a safe and healthy environment is in place for all students and staff this fall. For this upcoming school year, all students will be in class full-time while continuing to follow recommended public health fundamentals. Our government believes that students learn best in the classroom, and we know how eager students are to return. Students and school staff are expected to continue following the COVID-safe basics, such as self-screening, hand hygiene, and staying home when sick. Public health officials will continue to monitor key data and local conditions, and schools will be prepared to implement possible additional public health measures. This plan has been developed in consultation with public health and does come with contingency plans to address potential changes in local communities or school situations. We have also consulted with other stakeholders, such as the Manitoba Teachers Society and the Manitoba School Boards Association. Obviously, things can change, as COVID has taught us over the last year and a half. Our school staff and teachers have shown incredible resilience over the terms of our COVID pandemic, and we've all learned a lot together. I do want to thank each and every one of them for their efforts to date, and thank you so much for your consideration. After 18 months of facing the global impacts of COVID-19 together, Manitoba is on the road to reopening, including our schools operating near normal. Children returning to full-time in-person learning is another example of a transition to a post-pandemic Manitoba and a return to normal life. This school year will focus on addressing the mental health and well-being of students. It will address the learning impacts from the pandemic and ensure supports for students with special needs. Our government is investing $58 million, which is dedicated to support safe schools. This includes a $5 million fund that has been provided to school divisions over the summer and for the start of the school year to assess and address learning impacts as the result of the pandemic. This investment will ensure that our children are safe in the classroom, giving them a much-needed sense of normalcy. When broken down, the funds will be used as follows: $40 million for additional staffing, learning and technology, and health and safety, $6 million for masks and personal protective equipment, $5 million for the kindergarten to grade 8 remote learning support center for students who are immunocompromised, and $2 million in a contingency fund. I'll now turn it over to Dr. Roussin for specifics around our Safe Schools reopening.
Oh, thanks, Minister. Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. As we begin to move our way towards a post-pandemic Manitoba, we're also beginning to move from public health orders to public health recommendations. Up until recently, one of the only tools we had to limit the transmission of COVID-19 were these very stringent public health restrictions. So they were effective and necessary, but they themselves had many significant effects on health and the economy. So it's always been the goal of public health to have the least restrictive orders in place for the least amount of time. Public health orders such as the ones we have in place now and throughout this pandemic were always justified based on the current risk level. So now we're in a place with lower case numbers, lower hospitalizations, lower severe outcomes. We're seeing much lower case counts. Immunization rates at the same time are increasing. And we know that vaccine is the best way to protect ourselves and those around us from transmission of the virus, but especially from severe outcomes. And so this has put us in a position to ease some of those restrictions as we continue our move towards this post-pandemic Manitoba, and this is all reflected in this back-to-school plan. So going forward, we're going to continue to see COVID-19 infections in the community. We're going to see them in schools. We're going to see a return of other respiratory illnesses in the community and in schools. Things like RSV and influenza, which unfortunately in the past have had severe outcomes in young people as well. But as our vaccines continue to increase, we're going to see a decline in the severe illnesses caused by COVID-19. So we need to focus less on daily case counts and more on those severe outcomes as we move forward. When most people 12 years and older immunize, exposures in schools are less likely to occur. When community transmission is lower, all of this transmission is much less likely to occur. So as a result, schools will be able to return to close to normal activities. In September, with some health and safety measures still in place, it's very important to get the kids back into school in as much a normal fashion as possible. As part of the province's plan to ensure the health and wellness of students, there's a renewed focus on immunization for school-aged youth. This will launch this fall. So right now, more than 65% of those aged 12 to 17 have received at least one dose of the COVID-19 vaccine. So this fall, immunization teams will attend all schools with students aged 12 to 17 to provide that second dose, first and second doses if necessary, and going to initially target those areas with lower vaccine uptake. And planning's underway for a school-based COVID-19 campaign for children aged 5 to 11 once those vaccines are approved in that category. Super sites will continue to take appointments well into the school year. Community-based pop-ups will continue to be offered along with the option of getting vaccinated from primary health care providers or local pharmacy. Public health and education officials are also putting in plans to ensure young people can catch up on important immunizations that may have been delayed due to the pandemic. So this includes immunizations such as HPV, hepatitis B, meningococcal disease, tetanus, diphtheria, and pertussis, as well as seasonal influenza, which we know will be making a resurgence this fall. This immunization campaign is expected to launch as early as this month. Additional details will be shared with parents and students and school communities as soon as possible. Our public health orders have changed over time. They've been changing with the epidemiology and the risk associated with COVID-19. What's not changed is that we've always had public health recommendations. We continue to strongly recommend people wear masks indoors, including schools, to protect themselves and others. And then, of course, these public health orders may change over time again, depending on what we see with transmission and risk of severe outcomes. If the public health situation does change or hospitalizations increase, or we don't continue the success of vaccine uptake, then we can always revisit these restrictions like we always have. There's been a lot of restrictions in place, a lot of varying restrictions in place over the pandemic, and so again, nothing is off the table. But in the meantime, we're strongly encouraging people to follow public health guidance. This includes wearing masks while indoors, staying home when you're sick, washing your hands. This transition from public health restrictions to public health guidance will take time, but we know there's so many benefits to having our children in class full-time. Supports their health and safety, as well as their mental health and well-being and how they learn. So this plan makes all those things a priority along with those vaccinations. So, I think we all need to be patient with each other as we make these transitions. There are some people who feel these loosening of restrictions maybe couldn't have come soon enough, while others are very apprehensive right now And so I think it's going to take time. I think we all need to focus on the fundamentals. We need to ensure that we're all aware that a fourth wave is coming, that COVID-19 isn't going away. But we do have the fundamentals at our disposal. We have increasing vaccine rates. And so as we move forward, we really want to keep the kids in school as much as possible. So thanks for that. If it's all right with the Minister, we'll take some questions now.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from Global News, Brittany.
Hi, good afternoon. Dr. Roussin, in the technical briefing that media had just a little while ago, we were told by one official that masks are critical in the safety fight against COVID-19 here. They're a critical component. Kids under the age of 12 are not eligible to get a vaccine yet. Why are we not mandating masks in school instead of just strongly recommending it?
Well, I mean, I think that masks are a component of those fundamentals. And so we're strongly recommending it. We're going to continue to strongly recommend it. And then again, we're right now in a state of very low community transmission with increasing vaccine numbers. So right now, the risk assessment is that we're recommending masks, but we're always going to be reviewing that. We're a month away from return to school. If things change, we can always reassess this. But right now, we have a recommendation, a strong recommendation for people to wear masks indoor public places, and that includes schools. And so we'll be reassessing that over time.
Thank you. And Minister Cullen, we talked a lot about ventilation and how improved ventilation is one way that we can help keep COVID-19 away. How many new HVAC systems have been installed or upgraded over the summer and over this past year in schools, and how specifically has the province improved ventilation?
Sure. Thanks for that question. And clearly, ventilation is one component about maintaining public safety. We last year's budget allocated $12 million to upgrades to ventilation in our 800 schools across the province. This year, we've allocated $10 million to ventilation projects across the province. We take advice on capital projects from our school boards. That's what they have recommended, and that's what we've invested in and plan to invest in.
From the Brandon Sun, Kimberly.
Good afternoon. Dr. Roussin, you say that the fourth wave is inevitable. And what I received today was we had a call from a parent who's saying that not making mask wearing mandatory for the vulnerable, specifically children who are too young to be vaccinated, is incompetent and irresponsible by the government. What do you say to that?
Yeah, I say what we've been saying. Right now, we're seeing very low community transmission. We have higher vaccine rates, which not only protects the people who are vaccinated, but the people around them, especially those who are unable to receive the vaccine. And that right now we're strongly recommending it. So we haven't removed anything. We want people to wear masks. We're strongly recommending this. And we're a month away from the start of school. So we're going to continue following things. Just like all of our public health orders, we're going to continue to review them. We're going to have them in place appropriate for the current level of risk. And so we'll keep following this.
Okay, thank you for that. This next question is for the Minister. If a parent chooses not to send their unvaccinated child to school, what supports are in place? And is 1,000 spots going to be enough for the province, especially if those spots for support for remote learning is for children who are immune compromised?
Yeah, sure. Appreciate the question. Certainly, we've set aside some resources for remote learning, especially for those children that are compromised, and we certainly want to make sure that gets addressed. Or I would say other members of the family of those that are immune compromised. We'll certainly look at the situation as that unfolds. We'll work with our school boards and individual schools as that evolves, see how many parents are reluctant to actually send their students to school. I think, as Dr. Roussin has pointed out, even last year, schools were really a fairly safe place to be. Now that we have more people vaccinated, it should be even a safer place to be. And certainly, we're recommending students wear masks indoors. We think that we can provide, with these recommendations, safe school facilities.
From CJOB, Clay.
Good afternoon, Minister Cullen. Just following up the Brandon Sun question, do you expect there will be a significant number of parents who will say, okay, masks are not mandatory, social distancing is not mandatory, there could be some students in there who are not vaccinated, so I'm just going to keep my kid home?
Yeah, I guess that remains to be seen, Clay. That's something that we will monitor over once school does get up and running. Obviously, schools will get some indication. I think prior to that, that's something that we will monitor. We have set aside resources for those children that clearly, under doctor's orders, shouldn't be attending school. So we do have those resources. If we see that other resources are needed, we'll base that on that assessment over the next coming weeks.
Okay, my follow-up is to Dr. Roussin. I would assume for this question, the vaccination clinics that will be going into various schools around the province, you're going into the low vaccination areas like Winkler and the RM of Fandley. Nothing seems to have really caused an uptick in vaccines in those areas. What makes you think this one might do the trick?
Well, anyone who's been hesitant or with vaccines, we really try to be respectful to listen to the concerns, to try to address them. And really what we can do overall is to ensure that access is not the issue. So we want to ensure that there's no one who is not receiving a vaccine because they don't have access to it. We want to be able to have that type of access to everyone. We want to be able to answer questions. And so it's hard to know what the level of success is, but it's just so important. For Manitoba to get to a post-pandemic place. It's so important to have our schools safe, for us to have the highest amount of people vaccinated as possible. So we're going to do whatever we can to try to get that going.
From the Winnipeg Sun, Josh.
Good afternoon. When we look at this, is this just a framework for school divisions to work with, to provide, and come up with their own specific plans, or are school divisions going to be held specifically to these regulations? Will they have much opportunity to improve or change what they do from what's being put forward here, as in if they wanted to make masks mandatory as opposed to just a strong recommendation? Is there going to be that opportunity for them to do so, or to put in different regulations depending on the region and the area for which the school is in?
Sure, I'll say two things to that, Josh. Clearly, we're making very strong recommendations about mask wearing, cohorting in the younger populations. We think that's important. We think we can provide, safe school settings with these recommendations in place. We will not stand in the way if school divisions want to take additional in regards to some of the recommendations that are laid out here. We're certainly, second of all, we're in a lot better place going into September than we were in June. And, very low transmission counts across the province. And we think we're in a really good place here when it comes to school safety as well. So I think that's really the message that Manitoba parents should get. Schools have been safe in the past. We're in a better place, and schools should be safe into the future. But again, we will be monitoring these situations. Again, last year we found hotspots in some schools, some communities, and we can react to those situations as they develop.
Okay. There's clearly a lot of apprehension out there among parents because they saw this last year where we went 13 days without a case and things were looking good heading into the school year, and then cases shot up. It's basing these changes on this, or strictly on vaccination rates and looking at, well, teachers and staff, they have no excuse really at this point not to be vaccinated, so they should be safer, and just looking at those who are 5 to 11. Is this what we're basing kind of this plan off of? Is just vaccinations that is the main driver of where we are now with these orders?
Well, it's certainly a component of it. Greater than 80% of eligible Manitobans receiving at least one dose, and that those second dose numbers continue to climb. So we know that vaccines are safe and effective at preventing transmission as well as severe outcomes. So absolutely, it's a big component of our step towards a post-pandemic Manitoba. But we also look at what is our current transmission that we're seeing. And so we see very low numbers right now. So again, we revisit these things frequently. We'll continue to follow all this and make adjustments as needed.
From CBC Radio Canada, Mina.
Yeah, hi. I was wondering, will the cohort rules extend to school transportation?
So I believe the transportation is returning to close to normal as possible for it, and then